Hello friend, welcome to the channel. In this video we are going to discuss about the stages of general anesthesia. Okay, this the order of the anesthesia in the central nervous system is progressed through the following order. This we can say that the CNS depression is progressive in the following order, that is from the cortex, then midbrain, then spinal cord, and then finally up to the medulla. Okay, there are basically what you can say, there are the four stages of the general anesthesia. There are four stages. We will discuss this one by one. Number one, that is the stage of voluntary excitement. It's also known as stage of analgesia. The second, that is the stage of involuntary excitement, also known as stage of delirium. Then third stage, that is the stage of surgical anesthesia. And then fourth, that is the last, which is known as the stage of medullary paralysis or the stage of respiratory. Okay, in the second stages, or the we can say that is the stage of involuntary excitement, the animal goes into this mental state of delirium, in which the animal is unable to think or unable to think properly. This what I can say, this that is the this stage of surgical anesthesia is again classified into four planes. These plane 1 and plane 2, they are collectively called as these stages. These are the plane 1 and plane 2. Just a second. This plane 1, plane 2 collectively called as the stage of this light surgical anesthesia, and the plane 3 and plane 4 is known as the deep surgical anesthesia. Now we will going to discuss in brief about the stage 1, which also known as the stage of voluntary excitement or stage of analgesia. Analgesia means loss of pain or pain relief, we can say. Okay, now we are going to discuss about this characteristic feature of this stage. This stage begins with the inhalation of the anesthesia to the loss of sensation. The excitement and struggling are the most characteristic feature of this stage. In this stage, the heart rate suddenly rapidly increases. It becomes faster and stronger. Then the respiration becomes the rapid and deep. The pupils get dilated. Then salivation. The effect is that it get the excessive salivation. Analgesia occurs without the loss of consciousness. It is in case of the horses, the struggling is more violent and voluntary breath holding may. Okay, now the stage second, also known as the stage of involuntary excitement or the stage of delirium. This stage begins with the depression of the corticular centers. Then with this proceeds with the loss of consciousness, depression of the voluntary center, and the muscle tones of the animals is suddenly increases, likely that we can see in the patients of the CD, that canine distemper. Then the breathing will be jerky, vomition will occur, involuntary micturition or defecations may occur in this stage. Then the heart rate increases further, blood pressure suddenly increases, then pupil dilate further. Then okay, the special feature is that nystagmus, that is the oscillation of eyeballs in its orbit. It occurs in case of the horses. It is a characteristic feature of this stage, which occurs only in case of horse, not in case of dog or cat. Then operative procedure should not be carried out in the second stage of anesthesia. The stage 1 and stage 2, collectively known as the induction stage. Okay, now stage 3 of general anesthesia, this is also known as the stage of surgical anesthesia. This begins with the depression of the cortex. Which proceeds through the depression of the midbrain and finally to the depression of the spinal cord. The pain sensation, consciousness, and spinal reflex get totally abolished. Then muscular relaxation occur in this stage. Then coordinated movement disappear. Nearly all surgical procedures are carried out in this stage. This stage 3 gets further classified into four planes, that plane 1, plane 2, plane 3, and plane 4. Now we will discuss about them one by one. Plane 1. In the plane 1, there is the automatic respiration, which is equally abdominal and thoracic. The eyeball start roving eyeball at rotate or the rotating eyeball, which then becomes the fix at the end of this stage. Then plane second, there is the regular but exclusive respiration. Fixed eyeball start dilating pupils in the lower plane. All the surgical operations or the procedures are occurs in this plane occurs, or we can say that are performed in the second plane of third stage of anesthesia, except the abdominal surgeries, which is performed in the plane third. Now plane 3. In plane 3, abdominal respiration get increases and thoracic respiration get reduced. Then there is the paralysis of intercostal muscles, which are responsible for the respiration. Then blood pressure start falling, pupil get dilated further, or the pupil dilation progresses. Then plane 4. In this plane there is a complete intercostal paralysis, complete dilation of pupil, light reflexes get totally lost. Then stage 4. Stage 4 also known as the stage of medullary paralysis or stage of respiratory arrest. In this stage, the respiratory efforts get weakened and which lead to the complete heart failure. Then the vital medullary centers are get paralyzed. Then leading to the respiratory failure and cardiac arrest. Some extra point which commonly asked in the exam or the MCQ type questions, they are this ether and chloroform induces the all four stages of anesthesia, that is the stage 1, stage 2, stage 3 and stage 4. Therefore it is known as the totipotent anesthetic. And the nitrous oxide and the trichloroethylene induces the stage 1 and stage 2, hence it is known as the incomplete anesthesia or 50% anesthesia or incomplete anesthetic. This nitrous oxide does not induce at the stage 3 and stage 4.